Hi, I'm Jeannie Bath. I'm a dentist. I'm the pharmacy lead for Oklahoma Mission of Mercy, and I would like to let you know how the pharmacy works at the Mission of Mercy. We have a pharmacy in the clinic, and so it works under the Oklahoma Board of Pharmacy dispensing dentist rules. So because Oklahoma Mission of Mercy is considered by the Board of Pharmacy and the Board of Dentistry as a big giant clinic, then the pharmacy is able to dispense from within without having the necessity of pharmacists having to be there, although we sometimes do have pharmacists too. But in order to make this legal throughout the clinic, we need to be able to write down the name of the dispensing dentist who has prescribed the medication. We need to keep a record of that, and then that log needs to be stored for 1 year, and that is stored with Mission of Mercy. So in order to make this work, whenever you do write a prescription as a dentist, you need to first make sure that you are a dispensing dentist within the state of Oklahoma, which is free. As when you sign up for your license, there's an option to be a dispensing dentist, and you can sign that for free. And then when you are at Mission of Mercy and you check the prescription and then you sign it, then make sure you print your name so that we can keep a good record of that. The formulary that we have is actually very small, just a handful of medications. So you'll pick right up with that as soon as you get here. The patient's experience before they get to the pharmacy, they will have waited in line, a lot of them overnight. Then they will be taken, they'll never be wandering around on the floor of the clinic by themselves. They'll be taken everywhere they go with a runner, and they'll go to triage to find out what they need, and they may go to anesthesia, they may go to hygiene, get their teeth clean, they may go to restorative, have fillings, or they may have teeth removed. There are also patients that will be coming from a family clinic with getting pediatric dental work done, or people that are in the families of the children. So with all of those things that have been through all of this, and the pharmacy is one of the last times that they have clinical contact before they get to the survey area. So they'll be glad to see you and also very glad to be done, sometimes getting a little bit impatient by that point. So what you do is you will get a form, and it will have the form that the patient has carried with them the whole time. On the back of that will be the list of the medications. One of those boxes will be checked, or sometimes more than one. It'll be signed and have a printed name of the dentist who has dispensed it. We'll take a look at that and print that on a log sheet, writing down the patient's name, the prescribing dentist's name. The patient will sign for receiving the medication, and you'll put your initials for counseling the patient on the medication. Also, you'll fill out a label at the same time with that same information, shy of the patient's signature, and you'll put the label on the medication vial. You can, of course, take a look inside the vial, make sure it's really got what it's supposed to have in there, and show it to the patient so that they know what to expect and to know that you've seen it. The vials are pre-filled, which makes it very easy for us. In the event of needing more medication than we had thought that we needed, we'll have some extras and some pill counters so that we can do that if we need to, but planning to have as many of them filled as we can. Once the patient is finished, we would send them on with a runner to the patient survey. So they will come to us with a runner, they'll be brought to the pharmacy, and then they will be taken away too. So we don't necessarily have to tell them where to go, although we'll figure it out pretty quickly if we do. The last thing before they leave, we want to check to see if they have any more questions or concerns. We'll know in our area where the nearest dentist is to be able to ask any clinical questions. And their next stop is patient survey, and then they'll be able to finally leave for the day. Thank you again very much for your time and for volunteering your pharmacy expertise in this situation. We'll look forward to our collaboration as professionals at this event.